Hi, it's Adrian from Advanced Dental Artistry. Moving the midline. Well, when we look at symmetry and digital smile design, one of the things is we try and get the front teeth or the position of the front teeth in line with the midline of the face. So that means when we look at smile design and DSD, we can see that if we draw a line from pupil to pupil and draw a line in the middle of this, is that this is usually the middle of the face and it's usually the middle of the two front teeth. I'm going to talk you through a case today of Cameron. He's a lovely young man. He's in his 20s and he's actually come to see me as a second opinion. And I think this case is actually very important because it highlights the need for doing your research and actually considering other options when it comes to treatment. But also for all cases, there's a biological compromise. Naturally, when we're doing treatment, we want to get the most perfect result we can. But there's always going to be limitations. There's limitations, of course, from the soft tissue, the gums, the smile, the teeth, and in this case, the position of the tooth after trauma happened to his front teeth. So this is Cameron. He is in his early 20s and he's actually come to see me as a second opinion. As a young boy, he was actually hit playing hockey and he lost one of his front teeth. And the orthodontist actually moved his front tooth to be right in the middle. So now he's only got one front tooth, one central incisor, and it's right in the middle. And the problem at the moment is now, of course, the smile looks very out of balance. When you look at his smile and you look very carefully, you can see that this front tooth is very dominant and it really takes up his lot of smile. He's very conscious about this. So he went for a number of opinions, and one of them, of course, was orthodontics. Can we move all the teeth around and actually create space for a new front tooth and maybe put a dental implant in that situation? Braces wasn't really an option where he didn't want to look at the option. He had braces before and he has now a very important job where he's actually talking and dealing with the public and he didn't want to go through braces. One of the other options that he was given to by another practitioner was to actually remove 3 front teeth and actually place dental implants. But because Cameron's in his early 20s, he's not really a candidate for dental implants because his jaw will continue to grow. And generally the feeling is the later you can leave implants in the front of the mouth, the better, because then we end up with less likelihood of compromise or cosmetic complications as the bone grows around the implant over time. So when he first came to see me, we really wanted to look at, could we actually do porcelain veneers on him in order to actually give the illusion that he had his 2 front teeth, but also just to move the midline just a small amount. So I'm going to talk you through the case. It's a wonderful case because it's actually the son of a very, very old primary school friend, and he's come to see me, so I really want to make sure that this case is absolutely perfect. So I'm going to talk you through the case and I'll catch up with you at the end. This is Cameron actually on his first visit, and he's going to tell us a bit of history about what happened.
When did the accident happen? How long ago is it?
7 years.
So 7 years ago, you're playing hockey, the stick was at the end of the stick or the actual
It was the end of the stick. Someone flicked it like that and it just straight direct impact into my mouth. And I don't really remember much of it, but I didn't know my tooth was missing until I got to the dentist.
It's quite a traumatic injury actually when you consider that he lost his front tooth at a very young age. One of the really nice things is actually doing what we call a trial smile before we even actually decide on treatment, or actually allowing Cameron to decide on whether he would like to go ahead with treatment. So this is an example of a trial smile over the top of his teeth, and you can see the before and after here where you can see an obvious difference. A close-up shows that all we've really done is actually covered his right hand side lateral tooth to make it shape more like a central tooth, and we've also turned the canine into a lateral tooth and his premolar on his right hand side into a canine tooth. So you can see that we've been able to create a bit more symmetry in this case just by working on those teeth. And at this point, really what I want to do is just make sure that he's actually very happy with that treatment so that he can decide on whether he wants to go ahead further and look at doing porcelain veneers. One of the things is that when they first look at their smile, it can be a bit quite overwhelming because they've never actually seen their smile like that before. So this is actually Cameron's reaction when he first sees his new smile on the TV screen.
Oh wow.
It certainly looks better than one. Yeah, fantastic.
From here what we do is we actually get together with a ceramist, and this is one of our ceramists, Sue, and we're actually going to reanalyze the smile. So with that as a template, we then want to actually reanalyze the smile again and see if we can even improve this further. Cameron decided to go ahead with treatment. So his first visit was after we've actually redesigned the smile on models of his mouth, is that he wanted to do whitening. So this is Zoom whitening. It's probably the most effective whitening that we can use. It's been around for a long time, and it's actually in-chair whitening, and it's termed laser whitening, but it's actually just I suppose a very fast and very thorough way to actually do whitening, really to get the best whitening results. After that, we've done some preparation on Cameron's teeth, and what you can actually see here is he's very numb in this photo, but what we're again checking is whether the first trial smile that we have put in his mouth is actually correct. And this is when his teeth have been prepared, and we've actually put a trial smile over the front of his teeth. You can see him smiling here, and that's just a video. Again, his upper teeth is very, very numb. We then are going to reanalyze this trial smile, of course, so we're using cheek retractors here to get him to pull his lips out, and then we're going to do digital smile design again on this trial smile. This is now probably our third reanalyzation of the smile. Again, the idea is if we can actually analyze each step over and over again, we can make subtle improvements in order to ensure that the end result is as perfect as we can actually get it. So again, one of the most important things is actually to review this, when his lip's not numb, of course, review, and actually again getting Libby, one of the ceramists, to actually come up and do what we call a shade matching to really get the color of the teeth actually correct. This is a close-up now of the trial smile, and we're still refining this and making sure that this is actually okay. And that's a photo of his trial smile there. This is now the final review here of the before and trial smile. And of course, we do another reanalyzation of the smile to make sure that everything's perfect. Porcelain's actually made, and you can see Libby and Sue have actually finalized the porcelain here. And we just got some close-up shots of the porcelain, and of course the porcelain in the mouth. These are actually some final photos actually of Cameron. You can see his smile is complete there, and then we've got some before and after video here where you can see actually the difference in his smile. And one of the loveliest things was Andrew, Cameron's father, was actually my best friend in primary school, and he came to actually visit just to say thanks for treating his son Cameron. And this is a photo of us at the front, and here's a photo from us actually back in 1978, I think 78, 79, or the summer of 78, 79, and you can see we haven't changed a bit.
Well, thanks for watching Cameron's case, and you can see when we do careful planning, the results can be amazing. There is a compromise, of course, because the midline of this case, even when we finish, is not correct, but you can see the overall cosmetics of the case is nice. When we consider that midline in people is not always going to be exact, and we also know that people's eyes are not drawn to midlines so much. There's so many people that don't have midlines. Actually, correct one, of course, is Tom Cruise, whose midline is quite off, but generally we don't pick this up, and it's only when the midline is more than 2 or 3 millimeters that we will actually notice this. So thanks for watching. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.